Hello friends, today we will be discussing about that after how many days of taking Ipill the periods come. So Ipill or emergency contraceptive, basically first you need to understand that this is a hormone. When you will understand that what it is and how it works, then you will be able to understand that after how many days the period will come. So myself Dr. Dipti Jain, gynecologist, today we will be discussing about it in detail. So Ipill or emergency contraceptive basically contains 1.5 mg of levonorgestrel. Levonorgestrel is a kind of progesterone hormone. Your monthly periods are dependent on hormones, estrogen and progesterone hormones. So what happens? If you take Ipill or emergency contraceptive, it depends on which cycle time duration you are taking this medicine. That means whether you are taking in the first half of your cycle or in the second half of your cycle. First half of your periods are dependent on estrogen hormone and the second half of your periods are dependent on progesterone hormone. Emergency contraceptive has to be taken within 72 hours of unprotected relationship. So fine, you have taken it supposedly in the first half of your cycle. If you have taken in your first half of your cycle, that means if your cycle length is almost 30 days, then you have taken it in the initial first 15 days. Then what is going to happen? Since first 15 days is an estrogen dependent time. So if you take this Ipill at that time, then the uterine lining will increase to small extent. But since it is an estrogen dependent duration, and you will take Ipill just once and this will be withdrawal. So there will be a withdrawal bleeding. That means the period will come in 4, 5 or 7 days. That means the cycle will get shortened. You will get a short cycle. You will feel that the periods have come very early. Although this type of bleeding would be very less as compared to your regular routine bleeding or regular routine periods. Because this bleeding is just because of the levonorgestrel, the Ipill which you have taken, and that has increased the uterine lining and that is now shutting off. So that is why you are getting your period which is early usually. What happens if you take the same medicine in your second half of your cycle? That means in the later 15 days of your periods. This second half of your cycle is a progesterone dependent duration. So if you take Ipill at this time, then what happens? Otherwise also in the body progesterone level is high and as a result of which uterine lining is getting thickened. And you have added levonorgestrel in it. So the lining will get more thicker. So your period will get delayed. Instead of coming early, this time it will get delayed. It may get delayed to 2 days, 3 days, 5 days, maximum 7 days. So if you have taken Ipill or emergency contraceptive in the second half of this cycle, then you are going to get a delayed period. Okay, if you have taken it first half of your period, it will be an early period and a lighter period. But if you have taken it in the second half of your cycle, it will be a delayed period and it may be a heavy period because of the Ipill, the hormone levels have gone higher, lining has become more thickened and more thick lining is now shedding off. So you may get a heavy period, right? But sometimes what happens, even a week after your expected duration of your period passes off and you do not get your periods. So what to do? Definitely you have to go for a pregnancy test because Ipill is 80 to 90% effective only. It is not considered as 100% effective. Why? Because the mechanism of Ipill, what it does, it basically inhibits ovulation. What happens if ovulation has already occurred? Then it is going to make your cervical mucus thick, as a result of which sperms won't be able to travel inside the uterus and fertilization will not happen. What happens if the fertilization has already occurred? Then it will make the uterine lining unfriendly for the implantation. So implantation won't occur and you are not going to get pregnancy in either of these 3 conditions. But if implantation has already occurred, then it is not going to terminate the pregnancy, it is not going to affect, right? So there remain possibility of around 10 to 20% that you may conceive even if you have taken Ipill. Ipill may fail in 10 to 20% of the cases, right? So ideally the time at which you have taken Ipill, within 3 weeks of that duration you should get your period. If you have not got your period within 3 weeks or within 1 week of your expected timing of period, then you have to do a pregnancy test to confirm whether the pregnancy is there or not. If you are taking Ipill, then beyond this irregular periods, you can expect some other effects as well, like you may get a nausea, vomiting, mood changes, dizziness or a headache out of this Ipill. One more important thing I want to tell you, that Ipill may fail specifically when implantation has already occurred. It may fail in two other conditions as well. If you are obese or your weight is more, specifically if it is more than 72 kgs, then it may fail because the doses will be lesser as compared to your body weight. Thirdly, it may fail if you have already vomited within an hour or two of taking this Ipill. Okay, so it is very important to check for the pregnancy, get a home pregnancy urine test done. If you are not getting your periods, even after you have passed 1 week after your expected period. If you have any more confusion regarding this Ipill, you can write us down in the comment box section and can subscribe the channel. Thank you.